Hi, my name is Isidora Varas, and I'm a neuroscience major with a minor in pre-health, taking nutritional neuroscience with Dr. Kalman. On this video, I'm going to talk about 3 articles that discuss the connection between omega-3 fatty acids and different aspects of autism spectrum disorder. 2 of these studies talk about the relationship between omega-3 and inflammatory markers such as interleukin-1 beta, also referred to as IL-1 beta, which is a cytokine protein that mediates a wide range of inflammatory responses. And I'm also going to talk about 1 article that relates omega-3 to behavior and social communication. The article titled Randomized Controlled Trial of Omega-3 and 6 Fatty Acid Supplementation to Reduce Inflammation Markers in Children with Autism Spectrum Disorder was conducted at Ohio State University by Sarah A. Kane et al. This is a double-blind randomized study that tested fatty acid supplementation in children ages 2 to 6 who had been recently diagnosed with autism spectrum disorder. The participants received a daily oral fatty acid supplementation containing omega-3 and 6 or a placebo during 90 days, and the results were measured in plasma obtained from several blood collections throughout the experiment. The purpose of this experiment was to investigate if omega-3 and 6 supplementation could interrupt detrimental neurological pathways by reducing inflammation markers such as IL-1 beta, which is a hallmark in autism spectrum disorder. The study also aimed to evaluate safety and tolerability of the fatty acid supplement on children. The analysis revealed a statistically significant decrease in IL-2 inflammation and a slight reduction of inflammation in IL-1 beta compared to the children receiving a placebo. There were no major adverse effects reported, which indicate the supplements were safe and well tolerated by the children in the experiment. The second article, titled Inflammation IL-1 beta modifies the effect of vitamin D and omega-3 long-chain polyunsaturated fatty acids on core symptoms of autism spectrum disorder, an exploratory pilot study, was conducted in Auckland, New Zealand by Hayar Masaveri et al. 73 children between the ages of 2 and 8 with autism spectrum disorder completed a 12-month randomized double-blind placebo-controlled trial, and children were given vitamin D, omega-3, or both. The purpose of this experiment was to find if inflammation might affect how children with autism spectrum disorder respond to vitamin D or omega-3 supplements. If there is inflammation, these supplements could lead to more noticeable improvements in the main symptoms of autism spectrum disorder. The study found that children with elevated levels of interleukin-1 beta at baseline show a more significant improvement in core autism symptoms when treated with omega-3, vitamin D, or a combination of both, compared to the group of children who received the placebo. More specifically, omega-3 supplementation led to prominent improvements in total social responsiveness and social communicative functioning. On the other hand, the children with undetectable or normal IL-1 beta levels did not exhibit significant improvements in autism symptoms with any of the treatments. This third study, titled The Effect of Omega-3 Fatty Acid Supplementation on Social and Behavioral Disorders of Children with Autism and Randomized Clinical Trial, was conducted in Iran by Saeed Douaei et al. This is a double-blind randomized clinical trial conducted on 54 children with autism. The children were divided into 2 groups, the case and control. Children on the case group received 1 capsule of 1,000 milligrams of omega-3 daily, and the control received 1 capsule of 1,000 milligrams of medium-chain triglyceride daily as placebo for 8 weeks. The purpose of this study was to investigate the relationship between omega-3 fatty acid intake and the status of autistic signs such as stereotype behavior and social interaction in children with autism spectrum disorder. The study found that children in the intervention group had improved stereotype behaviors and social communication compared to the children who received only the placebo. The research also notes that all results were adjusted for age, gender, birth weight, body mass index, dietary intake, and maternal factors. The conclusion of this finding is that omega-3 supplementation shows positive advantages on children with autism spectrum disorder, but the study suggests that further research needs to be done in larger studies to confirm the results obtained in this specific article. I am personally interested in this research because 2 of my cousins have autism, and learning how diet can help them alongside the therapies is very useful. After reading these 3 articles, I learned that omega-3 fatty acids may help improve symptoms characteristic of autism spectrum disorder. The key findings indicate that omega-3 supplementation can help reduce inflammation, particularly in the IL-1 beta cytokine, which in turn may contribute to the reduction of typical autism spectrum disorder behaviors. Additionally, omega-3 supplementation was found to positively impact social communication skills and reduce stereotypical behaviors commonly observed in children with autism. This will impact my daily life as I can now relay this information to my family, who can start increasing the dietary intake of omega-3 on my cousins, and hopefully it will be able to help them alongside their current therapies. Thank you for listening.